Hey everyone, what's up? It's Dr. Charlie Johnson, physical therapist. In this video, I want to dive deep into what Bob and Brad, as well as many other physical therapists, yoga instructors, healthcare providers who deal with sciatica are claiming or labeling to be the single best approach for treating sciatica. That is, if you want to treat it naturally. So if you're suffering with sciatica, which is basically numbness, tingling, shooting pain going down the leg, usually below the level of the knee into the foot, then you probably noticed that everyone is telling you to do these sort of cobra or McKenzie press up movements, which basically bend your body backwards. But the reason I wanted to do a deep dive is I see a lot of people doing these things wrong. And, the issue is that lots of folks, including Bob and Brad and others on the internet, are not telling you or sharing how to determine if it's the right approach for you, as well as they don't give you other options to explore if it doesn't work. So I want to explain to you in this video some concepts that you need to understand to get the most bang for your buck if you're trying this approach in an effort to naturally solve sciatica. So be sure to watch to the end because I'm going to summarize everything I chat about. I'm going to show you 6 similar yet different ways you can move your body in the backwards direction to increase your chances of finding relief and fully explore this approach to see if it works for you. So in case you're new to my channel, my name is Dr. Charlie Johnson. I am a doctor of physical therapy and an orthopedic specialist, and I help people with back, buttock, and sciatic pains heal naturally by teaching them how to use movement as medicine. So if you'd like to learn how you can fix yourself so that you can try to avoid pills, shots, surgery, kick this thing naturally, and you don't want to rely on someone else to fix you, you want to learn how to do it for yourself, then I want you to hit the subscribe button as well as the bell, which will alert you for when I post content weekly on this channel. Also, if you're watching this video and you're still confused about whether or not you even have sciatica, or you're unclear about the potential cause or source of it, you're going to want to grab my DIY diagnostic guide. I call it a better than an MRI DIY diagnostic guide because it walks you step by step how to determine the most likely source of your pain from the comfort of your own home without ever needing to see a specialist and or getting imaging. So that being said, let's dive right into it. Real quick, before I talk about the different ways that you can do the McKenzie press up or the cobra or the backwards bendy motion to get the best potential results and natural relief from sciatica, to see basically if that direction or if that approach works for you, I need to help you bridge the gap. So a lot of people are stuck in the phase of trying to figure out what the cause of their sciatica is. The problem is that keeps them in research mode and it keeps them stuck, versus now we need to bridge the gap where it's like, hey, what is it, to what do I do about it? At some point you need to make that shift. In this video, I'm going to help you make that shift and further explore if this is an approach that you want to go down and give a test or give a trial to, or if this is something you might want to avoid. And again, at the end of the day, I want you to understand why you're doing it and understand sort of the way that the body moves and all the options that you have available for you. Okay, so like I said, a lot of people are stuck in the figuring out what the cause of their sciatica is. So there are many causes. This would be something that would be found on an image or just through listening to your story. We can kind of come to a conclusion about. So the number one most common cause of sciatica would be some type of disc problem, disc herniation, disc bulge. There's many various types there. Stenosis, arthritis, degenerative joint disease, degenerative disc disease are just some of the common causes, also facet, to name a few. And then there's probably many others, right? There's big, ugly, scary things. We're not going to chat about those now, but the point is that there's many problems within the spine, also outside of the spine. Piriformis syndrome is something, if you've watched my previous videos, I chat a bit about. Many different medical diagnoses that can cause sciatica. Again, the problem with getting stuck in what is it is that you get stuck in research mode. And these things, these problems only exist on an image. And if they only exist on an image, can you change what that image shows? And the answer is no. Only the surgeon can change that. So therefore, if you can't change it, then you have no control and no ability to solve your own problem. So this is where I want to bridge the gap. And I want to talk about the 2 common patterns that these causes or that these problems that exist on an image, sort of create, or how do these diagnoses show up in your life? So let's make it real for you. And let's talk about the 2 common patterns that show up in life. So now what I need you to understand is that there's 2 common patterns in general of people who present with sciatica. So they both have pain, numbness, tingling going down the leg, but they sort of have a different movement pain relationship. And I'll explain what I mean by that in a minute, because what you'll see is that it's really empowering once you understand, hey, wow, there's a pattern actually. This thing isn't as random as I thought. There's a pattern between the movements and the activities that I do and what I feel. So we're going to break that down. I'm going to share with you the 2 common patterns of people who have sciatica. So the first one on the left is people who have trouble doing these things. So the story sounds something like, Dr. Charlie, my back's gone out on me a few times. It started as just back pain, but now I have this pain. I'm tingling, sciatica down the leg. And man, at this point, I just hate sitting. It's terrible. It's the worst thing ever. Because I hate sitting, driving is just a nightmare. After I'm sitting for a while, it starts to ache. Maybe there's some pain, I'm tingling, or soreness down my leg. But then when I go to stand up, I can't. It's like blocked. I feel like there's a restriction to it. Bending over to try to put on my shoes or trying to lift things up is just so painful. Literally, I just can't tolerate it. And every time I do it, again, I get some type of sciatica or pain, I'm tingling down my leg. Basically, these things make me feel worse. But Dr. Charlie, once I get up and I start walking around, things ease up a little bit. I feel a little bit better. Also standing, anything I have to do for too long is not great, but walking and standing is generally better, or lying down. But again, man, that sitting, that driving, that going from a sitting to standing, that transitional moment, and getting out of the car, getting off the couch, getting up first thing in the morning, bending over to tie my shoes, stooping over to do dishes and or do makeup, lifting anything off the floor, really, really yucky. So this is one movement pain relationship. What do I mean? Let's break this down. So if we look at the sort of movement pattern of somebody in a seated position, this is really what it looks like. We've got somebody sitting. There will be the head, right? So there you are sitting. By the way, that looks very similar to driving. Or again, that idea of having to bend over, feed the cats, tie the shoes, right? That bent over position. How about if you're going to lift a box? All a very similar movement pattern. So you can see overwhelmingly there's this, position of being in a C or a forward bent position that the body does not like. But then when you zoom in and you listen to what the person does like, walking, standing, being upright, decompressing, lying down, most of these things involve the body being pretty upright, pretty neutral, maybe even a little bit of an arch back. All right. So again, if you look at the movement pattern, the movement pain relationship, yes, bending, lifting, sitting, they sound kind of different, but really at the end of the day, they're very similar as it relates to movement. So is standing and walking. So this person is telling you, hey, I don't really like doing things that move my body forward, but kind of moving them to neutral, getting off my feet and or moving them backwards might be an option that feels, again, smiley face, a little bit better. The other pattern or story that sort of aligns with somebody who could have sciatica would be almost, directly 180 or directly opposite of the story I just shared. So you might have somebody else who has pain, tingling going down the legs, and they say, hey, Charlie, standing is just terrible. I'm trying to walk my dog or, walk out to the mailbox and I just can't tolerate it. Lying down is painful and really yucky. So then when I ask them, well, what makes it feel better? What they say is, unlike the other folks on the left side here, they say, man, if I'm walking, I'm standing for a while, and my pain starts to get bad. If I just sit down, I feel so much better. If I bend over, that's actually what I do. I actually bend over, Charlie. I feel like I can just stretch out my lower back. It feels a little bit better. If I can lean over a shopping cart or onto a countertop, everything feels great. In fact, that seems to alleviate or help my symptoms. Feels good. So what's really cool about this is you can see the black and white. Now, again, this is sort of textbook case. Not everybody has, not everybody is all one side versus the other. Sometimes there's a mixture, but predominantly you'll start to notice if you write down sort of a list of what makes you feel better and makes you feel worse, you notice, wow, I really don't like the things that move me forward. The left side of the page here. Or no, those things actually make me feel better. So again, on the right side of the page there, you'll see that people who place themselves in an upright position, an arch back position, or a neutral position, they don't like those things. But as soon as they bend forward, that's something that they do like. Versus on the left side, again, the C-shape bending forward is something that is off limits. So now there's something I want you to be picking up on here. Maybe you are already, but just realize that on the right side of the column, you'll see that these people with sciatica both have same pain, numbness, tingling going down the leg. They can't stand to be upright. They don't like being in a neutral to arch back position. But the people on the left, they can't stand being bent forward. So they're sort of black and white. They're almost directly opposite. Again, this isn't always as clear. This is sort of textbook as we'd like. But if you write a list of all the things that make you feel worse and all the things that make you feel better, you'll start to see that there's probably more of a pattern than you once thought. Getting back to the topic of this video, it tells you what you should or what you might want to explore as an option for treating yourself, and some of the things that you might want to avoid or might want to change up in your lifestyle. So if we look at this, I would ask you, which do you think, which pattern of person dealing with sciatica do you think would probably respond best to moving their spine backwards, or doing a cobra, or exploring the sort of the McKenzie press up type of maneuver, moving their body backwards? But if we look at this, it's probably pretty clear that the people who don't like bending forward and the people who feel better bending backwards or walking, standing, being upright, those are the folks, right? So this left side, these are the folks who are going to want to explore this backwards motion. Somebody doing a little press up there. Versus if you're on this side over here and you go to do this motion, you can try it. I'm not saying you can't try it, but the chances are, and I would put my money on the fact that you're probably not going to like that motion. Why? Because you're already telling me that being neutral and or upright, standing, walking, things like that is really yucky for you, and bending forward is something that you would prefer. So just a tip there, tells you that you might want to explore this option if you're like the pattern on the left. It also tells you some of the things you're going to want to change up in your day-to-day routine. So something that I need you to understand, a big picture concept or principle that you should be grasping at this point, is what I call the rule of opposites. And it helps me determine, what's going to be best for this person. What's a really good starting point to help this person begin to solve this problem, potentially find relief. So again, just know that there's not one perfect way to solve sciatica. There are many different ways you can move the body, but just like trying to steer a car when the car is not moving, you have to get started somewhere. So we've already talked about medical diagnosis, movement pain relationship. We found out that going forward was really jammed and really yucky for the one classic pattern of people who deal with sciatica versus the other one. All right, so think of it like this. If you're driving down the road, we'll get back to this in a second, but I need you to understand this concept. You're driving down the road and you're going north. So you're going northbound, and you're in a ton of traffic. All right, so let's just say northbound lanes are jammed. What happens if you're sitting there talking to maybe your partner, your kids, or something like that, and you're just chilling, rolling your eyeballs, and you look, to the left side or whatever, you look to the opposite side of the road where the traffic's going southbound? What's happening? Usually traffic is just flying by, so everything is good to go. And in your head, you're saying, "Whew, I wonder if I could get over there." Maybe you're even one of those people who drives through the grass. Don't do that. Or you make a U-turn or something like that. But the point is that you might get off an exit, go southbound, and try to reroute, because usually the opposite of what is jammed is usually pretty clear. Hopefully that makes sense. So when it comes to looking at ways to solve movement pain problems within the body, such as sciatica hurts when you do certain motions, you probably figured that out already, is that you need to understand the body can move forward, it can move to the right, it can move backwards, and it can move to the left. So, the cardinal directions, never eat soggy waffles. Well, the body kind of has the same. And yes, there are some different directions in between, but the body can move this way, right, and left. And we want to use this rule of opposites to help us determine what we should be doing and maybe why this approach is something that's going to help you. So just like we mentioned, if going forwards, this picture of this person right here, is really yucky and off limits, so forwards is jammed, then often the southbound lane, or going the opposite direction, is something that is free and something that potentially can make you feel better. So rather than moving into yucky, which a lot of people with, these sciatica problems, they try stretching their hamstrings, try nerve flossing, try bending forward, try doing all these funky things, but they're just moving into restriction, into where the body doesn't want to go, into yuckiness. Well, why not do a U-turn and look the exact opposite? A lot of times, if moving forwards is creating yuckiness or not allowing you to heal, then doing the opposite. What's the opposite of not healing? Healing. What's the opposite of going forward? Backwards. So this is why I believe this motion helps a lot of people. It's because it just does the opposite of what most people do in their lives, and it goes into the opposite direction of the way that many people try to approach this very painful problem. So we can see that, again, going forward is yucky, going backwards is often free and clear. So let's go ahead and let's try the cobra or try the press up. The other reason I think this works is that it's the direct opposite approach. So not only can you go in the opposite direction of that which is really yucky, so going forwards is yucky, go backwards, but you can go the opposite approach. So if I were to tuck my shirt in here, right, or kind of pin it down, if I'm going forward and, oh, that's really restricted, bending, sitting, lifting, all those things. Well, what's the opposite of lengthening? Taking point A and point B further apart. That's how we'll define it. Well, it's shortening. So now if we kind of bring it together, right, we create slack, or we bring those 2 points together, which in this case would be some type of backwards motion or backwards bend. So again, this is not only McKenzie press up, as people sort of label it. McKenzie is not just about press ups, by the way, but that's sort of how it's labeled. That direction of a press up and or cobra, this backwards bendy motion, is not only the opposite direction of what is yuckiest for many people with sciatica, but it also, instead of lengthening the tissue, it shortens it, which a lot of tissue likes. A lot of people try to stretch things out when really the tissue needs to be shortened. So now here's the fun part. Here's where we're going to show you 6 different ways you can do this motion. So if you're trying it, look, and it's working, just keep going. But a lot of times it doesn't work, and we need some different ways to explore this motion to see before we just say, hey, it's not going to work for me, Charlie, before we move on. So just get that in this picture, bad drawings. I know I'll stick to my day job here. But the idea is that you can move the body from above or from below. So picture that little circle there in the purple as sort of the hinge point. And the traditional press up is sort of here, where you start neutral like the guy at the top, and then you go ahead and you use your arms as a jack to push you upwards and backwards. And the goal is, again, you kind of stretch out some of the tissue in the lower spine. And that's one way to do it, but that's only one way to do it. So what if it doesn't work? Well, the other way you could do it is that you could keep the back flat and just move the legs. So you can see legs only motion down here. And so that's one way that you can kind of expand your possibilities for healing. But then also don't forget that you have a right versus a left side. And I'll go ahead and show you all these options here in a moment as I sort of review everything. But point is, if you're laying down, you're looking from above, you're laying there getting ready to do a press up. Yeah, you can go and you can just do a motion straight dead center pushing up. But you can also move your body to the right and move your body to the left from above, or you can do the right side from below, kicking your leg up on the right side, or the left side from below. So basically, you've got 6 different options here. I'm going to walk through them to make this really clear for you, such you're doing the press up is working great. But if you want to explore other options to maximize your ability to heal, then I'd give these a shot. And finally, I'm going to show you a way to completely reverse engineer the McKenzie press up and this whole backwards motion approach. And this works much better in my experience for the clients that I work with versus the traditional cobra approach. So you're going to want to hang around. I'll show you that here in a moment, but it's a super cool way and super simple way that even if you have shoulder problems or other problems, that you can still achieve the same motion, and oftentimes you get a better result. So now what I want to do is I want to show you 6 different ways that you can do the press up or the cobra motion to help you fully explore to see if this approach will work for you. So the classic press up is just something that you kind of do in the center of the body. You're not moving to the right, you're not moving to the left. But if you apply that from above or from below concept, from above, again, meaning when you just move the back component, or below when you move the leg component, you end up with these sort of 6 different ways. Maybe there's even more, but we'll walk through them. So this is just the first one. Everybody knows this motion. Legs stay still. Your arms are the jack that pushes you up. But another way, let's just say that increases your pain, known as tingling. It's not working for you. Well, the second way that you could try is you could say, hey, well, what if I just walk my body a little bit to the right? What does that do if I just move from above If that doesn't work, still increase your pain and tingling. Just not, it's too yucky, just not having it. Then you can go to the left. You see, you don't have to go that far. You just want to start to explore motion and feel good doing it. Let's just say that all those are off limits. They're just completely yucky. Kind of a bonus thing you could try is take the one leg. Try that. You might find that that feels better, or maybe it doesn't. Another way you can try is the other leg. Try that. Again, you're looking for the one that feels best, allows you to move most freely, and reduces any type of pain and tingling going down the leg. I would not push into something that feels painful and or shoots pain down your leg. That's yucky. That's off limits. So we just talked about ways you can move it from above. How can we move the body from below to further explore? Let's just say none of those motions worked. Here's what we would do. So what I would do is I would grab a pillow or two. You don't need one, but it's just helpful. And I would lay flat on my belly like this, put my pelvis right over the top of it. And instead of moving our back from above, you're going to move your legs. You're going to test a few reps of each of these. By the way, it feels more comfy to bend it a little bit. Whatever feels best, that's fine. All right. Then the other leg. So now this is the left leg from below. Again, you can bend it, do whatever feels best. And the idea is that you're trying to find which one feels best. We talked about going center, right, left, from above, right leg kick back, left leg kick back. Now I want to show you how to reverse engineer the press up. This is actually the one that people, in my experience, respond best to, and I want to share it with you now. So the traditional McKenzie press up and or cobra puts you in this position. So just snapshot that, get an idea of what that looks like if you're doing it, get an idea of what that feels like. Now what I want you to do is I want you to reverse engineer it. So I want you to do it kind of backwards. So in the traditional kind of push-up maneuver, you're having to use a lot of arm strength to get yourself up there. A lot of people just can't tolerate that. So what you're going to do is you're going to get all fours, put your hands just slightly above like your head. You can see that. And you're going to just drop your hips in. What's really cool about this is gravity just helping you. And your arms are just locked out, so there's not a lot of strength needed for this. Most people can tolerate this better. And because gravity is helping you, you're not pushing against resistance. You're dropping into any resistance that you have. And you just want to see how that feels. So again, this is more tolerable. This is still gets you to the same end position, but it's often easier for people and in my experience, more effective. So those are the various ways, 6 plus maybe a couple other options for you that I want you to try if you haven't found that the traditional press up or cobra is working for you. So if it's not working for you, go ahead, test those things out, find which one feels best, allows you to move with the most comfort, furthest into the range of motion, and reduces your leg pain, numbness, or tingling. All right, so there you have it. Many ways you can start to think outside the box and tweak that backwards bendy motion to find what works for you. I'd absolutely love if, as you go through those motions one by one, and again, you find the one that feels the best for you, relieves the most symptoms for you, just comment below and let me know what that was. Was it moving the body from above? Was it just the normal way that Bob and Brad and everybody else describes it? Did that work best? Or did moving the legs from below seem to help you out? Let me know by commenting below. Also, make sure you hit the subscribe button and bell so that you get alerted when I post more content next week. So that's it, everyone. Until next time, chat soon.